determine the present or suspected microorganism of the patient through the medical records or by reviewing the patient. We're then going to identify the proper isolation for the microorganism. Then we're going to check all our equipment in the PPE card. And make sure to take note of any signages on our patient's door or outside of their room. So at the end of our teaching session, the patient and the significant other will be able to do the proper way of donning and removing of the personal protective equipment in order to inhibit transmission of pathological microorganisms. Wear shoe coverings or boots if necessary. We're now going to wear our isolation gown. So wear the isolation gown, making sure that the opening is at the rear part of the anatomy. Secure by taping the nape and lower back area. Since my gown has to be tied 2 times, that is what I did. Wear the appropriate type of mask. For a surgical or ear loop mask, place the mask over the nose, mouth, and chin. Make sure to flatten the metal piece over the nose bridge. Then you can adjust the mask to fit your face. For respirators such as N95 masks, select the appropriate size of the respirator. Cup the mask over the mouth, nose, and chin. Flatten the metal piece over the nose bridge. Then secure the upper ties at the back of the head and lower ties at the base of the neck. Make sure that straps are not crisscrossed. Then adjust the respirator to fit your face. Do a fit check by inhalation and expiration. Once you inhale, the mask should feel tighter and it should draw in. There should be no leaks. Once you expire, you should cup both hands around the respirator. Now we're going to wear our buffet cap. Wear your goggles or face shields. Now we're gonna put on our clean gloves. When you're wearing your clean gloves, securely tuck the cuffs inside each glove before entering the room. We're now all set and ready to enter the room. Before leaving the room, make sure to remove the gloves and dispose. Grasp and pull the glove away from the hand. Slide 1 or 2 fingers of the bare hand inside the wrist of the gloved hand, then dispose the gloves in the yellow bin. Now we're going to remove and discard our buffet cap. Then we're going to remove our goggles or face shields. Now we're going to remove our isolation gown. You're going to want to unfasten the ties at the lower back first before the nape area. Slip the hands underneath the gown at the neck and peel away from the shoulders. Remove the booties or the shoe cover. Leave the room, use a paper towel and holding the doorknob. We're now going to remove our N95 respirator. The bottom elastic bands should be lifted over the head first. Lift the remaining top bands over the head away from the face, and then dispose it in the yellow bin. The healthcare provider, the significant other, and the patient was able to demonstrate the proper way of wearing and removing the personal protective equipment and prevented the transmission of infectious microorganisms from the patient to the surrounding.